Wishing I could take a break from this world. Running on a hamster wheel, but searching for something I can't feel. I just wanna be a lost girl and fly. Take a breath, feel my wings spread, levitate above the ground and make eye contact with clouds. Now I'm rising, I'm soaring above it all. I just wanna be free, finally, finally, finally. I wanna be free, finally, finally. I wanna be free, finally, finally, finally. I wanna be free.
Hi there. My name is Rania Copeland, and I am the president and CEO of the Black AIDS Institute. The Black AIDS Institute works to mobilize Black individuals and institutions to confront HIV. And now we are addressing a new challenge facing the HIV and Black community, and that is COVID-19. So today we are thrilled to have with us arguably the most important public health leader in the world today, Dr. Anthony Fauci. He is here to help address for us what the COVID-19 disease means for our people. I'd like to start by introducing the BAI board members who will join me to host tonight's conversation with our esteemed guests. First, we have Grizel Howard, chair of the BAI board of directors. Grizel is the founder and CEO of the strategic consulting firm King & Kairos Inc. As a health advocate, she has been the architect of community engagement initiatives that have changed the trajectory of major health concerns, including the Back to Sleep campaign that is still considered one of the most successful National Institutes of Health, NIH, National Institute of Child Health and Human Development, NICHD, public-private partnerships. Grizel, thank you for joining us tonight and all that you do to support and extend the work of BAI. We are also joined this evening by Marlene McNeese, a member of BAI's board of directors and the assistant director at the Houston Health Department Disease Prevention and Control Division. For 26 years, Marlene has played a leadership role in designing public health and community-based support systems that address HIV prevention, chemical dependency, mental health, communicable diseases, and post-incarceration syndrome. Currently, Marlene is on the front lines fighting the COVID-19 pandemic in Houston. Serving as incident commander, she has been providing public health and policy recommendations for Houston's COVID-19 response. Marlene, welcome. Next, we have Jesse Milan, board chair emeritus of the Black AIDS Institute and president and CEO of AIDS United, a national organization focused on grant making, policy, and capacity building. As a person living with HIV for over 3 decades, Milan is a recognized leader in the HIV community. We are now seeing states shutting back down and record-setting cases numbers in various places throughout the country. We have also heard about Project Warp Speed that is rapidly advancing vaccine and treatment clinical trials. Dr. Fauci, can you give us a rapid baseline of where we are at in the COVID-19 pandemic, particularly as it relates to Black people?
I'll just take a quick description of where we are in general, and then obviously that relates very, very significantly to the situation with African Americans. So the outbreak right now is obviously significant and severe. As you well know, we have close to 150,000 deaths in the country. We have millions of infections. And if you look at the curve of, as a nation, where we are, we went up to a high peak, came down, and unlike many of the European countries, we didn't go back down to a baseline that's very low, namely tens or hundreds of infections per day. We plateaued at about 20,000 per day. And we did that for multiple weeks until we started to try and open America again, namely do that kind of stepwise fashion. However, that was not done very successfully in certain parts of the country, particularly the southern states, so that now you're seeing 30, 40, 50, 60, and even 70,000 new cases a day, which obviously is not acceptable. However, within that context, what continues to happen is that you have a disproportion of burden, not only of infections themselves, but of the negative, deleterious, and serious consequences of getting infected. So if you look namely as a demographic group, the African American Black community, that you don't like to generalize, but in general, they are in jobs from an economic standpoint, from an employment standpoint, that does not allow them as much to protect themselves by doing things like virtual computer telework. They are generally in essential jobs that put them out in the community in exposure to people, so the likelihood of their getting infected is greater than the population in general. That's the first thing. The second thing that's equally as serious, but not as easy to overcome, is that no doubt the African Americans have, as an incidence and prevalence, a disproportionately higher rate of the kinds of comorbidities that lead to a serious outcome. And that is diabetes, hypertension, obesity, heart disease, kidney disease, chronic lung disease. So if you look at them as a population, I call it a double whammy. I mean, they're doubly disadvantaged. A, they have a greater chance of getting infected. And B, when they do get infected, they have a greater chance of hospitalization, intensive care, and dying. That is not acceptable, but it's true.
Dr. Fauci, you are a hero to people like me living with HIV. And so I wanted to ask you, what do people living with HIV really need to know or fear about COVID-19? Some of us are virally suppressed, some of us are not, and some of us are on a lot of medications. What do we really need to know about COVID, or what should we really be concerned about?
Okay, well, you should be as concerned as anyone else about protecting yourself from getting infected, because infection is not anything that is trivial. Even though a substantial proportion of people who get infected can either be without symptoms or have a relatively mild course. But the issue with HIV infection, Jesse, is complicated, because if you look at the conditions in which definitely it's a higher risk for severe outcome, HIV is not considered in that. HIV is considered in the group that it may be associated with severe outcome. And the reason is there's such a spectrum of persons living with HIV. I would imagine, because we know that immunosuppression, be it through immunosuppressive drugs, congenital, natural immunosuppression for a number of reasons, gives you a greater risk of a serious outcome. But if you look at someone who is living with HIV, is on antiretroviral therapy, and their CD4 count is 500, 600, whatever, I don't see them as any kind of a significantly greater risk. If you're looking at people, and there are many of these, Jesse, as you well know, who are living with HIV, but their viral load is not suppressed below detectable, they have a low CD4 count, they are immunodepressed. And when you're immunodepressed, you have a greater risk of an outcome that's serious. So maybe this would be an even greater reason to pay attention to getting people tested, HIV tested, getting them on drugs, and getting that viral load down. Because of the people, 14% or 15% of the people in the United States who are HIV infected don't even realize that they are living with HIV. Those are the ones that are likely more vulnerable. So there are a lot of things we can do right now during this challenge of COVID-19. One, protect yourself from getting infected with the SARS coronavirus 2. But two, if you're at a risk category for HIV, get tested, get on therapy, get your viral load down so you don't have a double risk, one of HIV and one of coronavirus.
Thank you, Dr. Fauci. Thank you. Marlene.
And thank you again for joining us, Dr. Fauci. I actually have a statement and a question. For over 20 years, the Black AIDS Institute has been by your side, working collectively with advocates and researchers to combat the HIV/AIDS epidemic in the Black community. With the appointed leadership of you and our global AIDS ambassador, Dr. Deborah Birx, the federal government seems to be building upon the expertise and leadership that we have in the HIV epidemic. What lessons can we learn from the HIV response that are applicable in this current COVID-19 pandemic?
Yeah, there are so many lessons, Marlene, for sure. You know, it's very interesting, talking to this group here, all of you who have been involved with HIV for so many years, is that it's the HIV community that's actually, in some respects, coming to the front to really show up and help out with coronavirus. Right now, I announced the start of the phase 3 trial for the first phase 3 trial for a coronavirus vaccine in the United States. Those trials are being conducted in some respects, not completely, but to a significant degree, by the HIV network that we all built over the decades, like 3 decades worth. I started the first HIV network, the AIDS Clinical Trial Group, decades ago. Then we had the Prevention Trials Network, the Vaccine Trials Network, et cetera, et cetera. All of that is being leveraged now to do a clinical trial for a coronavirus. But of all the things that we could learn was the importance of community engagement, which no one did it better than the relationship between the community and the investigators and the regulators during HIV. I mean, I can't think of a better example how we had both activist communities as well as communities that weren't activists but were just in the game. We need that to address the coronavirus outbreak. We absolutely do, particularly if we want to do carefully conducted, effective trials for both therapy and for vaccine. In other words, we've got to use the AIDS model that was so successful over so many years.
I think, Dr. Fauci, this speaks to how important public-private partnerships are as well. At NIH, you and your colleagues understand the importance of treating comorbidities comprehensively. The next question comes from Grizel, who has been one of the architects of the most successful public-private partnerships at NIH and ICHD that focused on reducing Black infant mortality due to sudden infant death syndrome. Grizel?
Dr. Fauci, it is wonderful to see you. As you know, I had the opportunity to cut my teeth at NIH with Dr. Vivian Pinn and Dr. Von Maddox, and you've already addressed the unique challenges African Americans and Blacks have with their comorbidities. But would you extend that conversation to say, if you are at risk of having diabetes, hypertension, obesity, what would you recommend we do if we contract COVID?
If you do. I mean, so that, that's a great question. So the way I look at this, there are, as I mentioned a few minutes ago, that the African-American community is twofold disadvantage: a greater likelihood of getting infected, and once infected, because of the social determinants of health and the diabetes and hypertension, a greater chance of getting a poor outcome. What we need to do as a government, as a state, as a local, is to concentrate resources in the areas of the country, be they states, cities, counties, that have a high demographic concentration of African Americans, because we need diagnosis quickly. We need access to health care. We got to get them into health care, and we got to make sure that if they have underlying conditions, they are recognized, diagnosed, and treated. The reason I say that is that within the group of those diseases, untreated or poorly controlled diabetes is always worse than well-controlled diabetes. Hypertension that is not pristinely controlled is always worse than well-controlled hypertension. The same thing with all the others. So if you feel you're at risk for these underlying conditions, we need to make sure there are resources for the healthcare to get the African Americans diagnosed for their underlying condition so they can get it under control, and rapid diagnosis if they happen to get infected with the coronavirus. Those are two things that can be done simultaneously.
So you'll appreciate this being a Regents man, and I'm a Marymount girl. The second part of this question is, would you be kind enough to explain antibodies and how they work?
Okay, so an antibody is a protein that the body makes in response to either an infection or any other challenge to the immune system. The immune system, evolutionarily, is part of an organ system in your body that protects you against outside and inside invaders. The outside invaders are all of the bad bugs out there, the viruses, the parasites, the bacteria. When the body sees that, it makes a couple of things. One of the things it makes is a protein. And what the protein does is that the protein binds to the virus or to the bacteria and prevents it from spreading in your body. So when you get infected, you make antibodies that ultimately help you to recover from infection. When you get vaccinated, the purpose of the vaccine is to actually induce the formation of antibodies in your system. And those antibodies bind. So this is what an antibody shape looks like. And if this is the virus, it binds to it and essentially neutralizes it. That's where we get the terminology of neutralizing antibodies, because it neutralizes the virus and makes it harmless.
Thank you. Would you recommend that we create some prophylactic treatments for people who are predisposed to these conditions?
We're working on that. That's a very good point. A number of the treatments that are going into clinical trials or that are already in clinical trials right now are to be given to people at high risk. Very, very high among those are people in nursing homes. Do you know that almost half of the deaths early on in the outbreak were among people in nursing homes? That's astounding. 40 some odd % of the deaths were in people in nursing homes. So if we get a good prophylaxis, that would be the first group that we would want to give that type.
Jesse?
So, Dr. Fauci, thank you for all the information you've given so far. But as we are all aware, we're in the middle of a national movement for racial justice. Systemic racism is a constant driver of health inequalities in the Black community. And so what are we doing in the medical and public health fields to ameliorate health inequities that are continuing with COVID-19? And what would you recommend communities do to stop this terrible health inequity that continues for Black people because of COVID-19?
Well, Jesse, I mean, that's a great question, but there's no easy answer to it because, you know, as you said, when something is systemic, that means it's ingrained. And if something is ingrained, you got to really work really hard to loosen it up, as it were. I think one of the things you said at the community level, I mean, the inequities are obvious. You don't have to be a rocket scientist to not see it. I mean, it's obvious in so many ways. I think the medical community, the public health community needs to be very vocal about demanding things be done to change that inequity. And it's not going to be something that happens overnight. That's for sure. I mean, access to health care, that clearly is something that needs to be worked on. But there are so many other more complicated issues that you really want to, increase. And again, I think it has to do with what you alluded to earlier, Jesse, about that racism that goes well beyond healthcare and health delivery. It's the things that provide a situation where the economic situation of many people who are African Americans doesn't allow them to be in a situation where they have access to healthcare. So one of the things that can be done broadly, you get the tide that brings all the boats up, is to increase the economic opportunities among the African American community. That would go a long, long way. So I think if we focus in on just increasing health, which is important, and there are things that we could do, if you go to 40,000 feet and look more broadly, what can we do to create a situation where you equalize the academic the economic opportunities. That's through education. That's through a variety of different ways that you can do that.
Marlene is on the front lines of fighting the COVID-19 pandemic, and not just kind of COVID-19, but really everything that you spoke about. And in Houston right now, she is serving as incident commander.
So Dr. Fauci, testing. In my seat here at the Houston Health Department, there continues to be a high volume of calls around testing, and I think confusion remains. What are the different types of tests? How do these various tests work? What do the test results mean? Can you provide us just some additional clarity about these tests?
Yeah. So I think for the general public, I know that you understand this very well, but for the general public who might be listening, you could either test for the virus itself to know if you are now infected, or you can test for antibodies, which I just described, which means you have been infected, you likely have recovered, and now you have some degree of immunity. So the most definitive test is a test for the virus itself. It's usually a molecular test. You get a swab, you go into the person's nose, you pull it out, you stick it in, you extract the RNA, and you do an amplification by a molecular means to see if the virus is there. That's the good news. It's very specific and is very sensitive. The bad news is that in some circumstances, you don't get the results back in a timely manner. You would like to get them back within 24, at the most 48 hours, but often in some places, not all, in some places, it takes 5 to 7 days. So if you're going to do contact tracing, that's very tough to do contact tracing when you're waiting 5 to 7 or more days to get the results back. There's another test for the virus that's a rapid test. It's an Abbott ID Now test, which means you do the same thing, you get a little swab in the nose, only it takes 15 minutes, not a few days. That is not as sensitive as the one that requires extraction. That's the bad news. It's not as sensitive. The good news is that it's very quick. So that one is used more for broad surveillance to see what the penetrance of infection is. Whereas the first one is if you really want to know if you or I are infected. We don't want to know how many infections there are in the community. That's surveillance test. There's also a test for antigen, which has a greater capability of scaling up and doing high throughput. Namely, you don't test for the actual virus, you test for a protein on the virus, and that's called the antigen test. And then the final test is the one for antibodies, namely measure the antibodies in your serum or your plasma that are directed, and you can say, well, I know you've been infected. You may not be infected now, but you have been infected in the past.
And you also mentioned contact tracing, and we have to talk about contact tracing in this way. It scares people to have someone they do not know from the public health department call them up with news about their health. Tell us about the importance of contact tracing, and how do we encourage Black America not only to understand it, but to engage in such a critical strategy in stopping the spread of COVID-19?
So contact tracing in its simple form means if I'm infected and it's known that I'm infected, I will have, because I didn't know I was infected, had contact with any of a number of people. The chances are that I have transmitted the virus to one or more of those people. That is the way pandemics emerge, and that's the way viruses spread. And the reason you want to do tracing, not that you want to encroach on anybody's privacy, but it's important to know that if I've been in contact with, let's say, 10 people, and I've infected 2 of them, there are 2 things you need to know. It could be that if you identify the person who's infected, you can get them to care quickly. Secondly, many people get infected but are without symptoms. If you can identify the person who is infected with no symptoms, you could warn them that they're infected, get them to isolate themselves so that they won't wind up infecting many other people. So that's the whole purpose, is to protect the people you may have exposed and to prevent further spread. The word contact tracing sometimes makes people shiver because that means you're encroaching upon the privacy. Why do you need to know who I was in contact with over the last couple of days? The answer is because we want to help those people, we want to protect them, and we want to prevent the spread of virus in the community. We don't want to encroach on anyone's privacy.
That was great, Dr. Fauci. That was a great transition into our video question we have from Cedric Sturdivant. Cedric is a member of our BTAN, our Black Treatment and Advocacy Network in Mississippi. BTAN currently has 14 chapters and 12 affiliates. BTAN is a well-informed and well-equipped collective of advocates that advocate to address the barriers in Black communities through knowledge transfer, mobilization, community engagement, and community building.
I'm living with HIV and survived COVID. I live in an intergenerational home, and some of my family members are essential workers. I know that when the vaccine becomes available, it will be important. But honestly, I'm nervous about any vaccine that comes out. I want to be in the second or third wave of people to get the vaccine to see how they do. The U.S. government has done a lot of horrible things to Black people, and I want to make sure that this isn't one of those horrible things. Dr. Fauci, if a vaccine becomes available, will you get it? Would you recommend that your family get the vaccine? When will you recommend your family get the vaccine?
Good question. And that's easy. That's an easy one to answer. Yes, if the vaccine is shown to be safe and effective, I definitely would take it. I would recommend to my wife and my 3 daughters that they also take it, because I feel confident that if the data in a good experimental trial show that it's safe and effective, it would be advantageous for me to take the vaccine, particularly because I'm in an age category that is at higher risk of a serious complication. When we made the announcement about the vaccine phase 3 trial, was on a FaceTime Live with an African-American woman who was giving an explanation for understanding, given the history, like Tuskegee, which was a terrible stain on the history of public health and medicine, where African-American men were part of an experiment that was clearly unethical. The traces of distrust go to today. So what I would tell this person is that one of the reasons why it's so important that we do everything in a transparent way, you understand everything about the vaccine, including its potential adverse events, which thus far look like they're really minimal, of the benefit, because of what we just said, that if an African-American person gets infected with coronavirus, the chances of them getting a bad outcome, hospitalization and death, is much higher than the general population, and certainly much higher than Caucasians. So I would have to get community members to talk to that person to try and say, yes, we do understand and admit the injustices and the unethical behavior that has been essentially, sprinkled through history when it comes to African Americans and public health. But we need to put that behind us, because it would be a terrible shame if, because of the evils of what occurred years ago, decades ago, the African American community will deprive themselves of something that could actually be life-saving. And what they need to do, they need to hear that from people that they trust, from community people who have looked at the situation, analyzed it, and want to talk to them, as opposed to someone like me who, they may not trust me because I don't come from that background. And that's fine with me. But I think what they need to do is to hear it from people that they really trust.
Yes. So the world is waiting for the vaccine. And the Black community is curious and wanting to know, what is the Black participation in the current clinical trials?
Good question. We have made it a very, very important goal and mandate to reach out by community engagement to get a very proper and appropriate representation of the African American community in the clinical trial, because it's important to know from the clinical trial, is there any difference in the response of the African American community to this? Difference in the degree of induction of an immune response, difference in the degree of efficacy, difference in the degree of potential adverse events. It's very, very important. And we've made that a major goal of the trial, to have adequate representation of the African American community in the trial itself.
Dr. Fauci, as a trusted resource and ally, can you tell us what you believe should be done to stop the continuing medical mistrust in Black communities?
Yeah, I think what we need to just show by example that we are very sincere in getting the African American community to be well represented in the advantages of clinical trials and the advantages of the interventions that result from that. Because you're right, and no one denies it, historically, they've been put at a disadvantage. But there are so many advantages that are shared by the non-African American community. It would be a shame, because of understandable distrust, to have the African American community on their own accord deprive themselves from the advantages of things like vaccines.
Yeah, I think right now a hot topic, in our community here in Houston, we're sitting in one of the unfortunate hotbeds where we don't seem to have current control over what is occurring with COVID-19 and whether or not we're participating in the decisions that are being made with school boards and school districts and their plans around reopening. What guidance would you have for cities like ours that are grappling with, rates and new infections that are out of control versus our, need and want in some ways to get our children back to healthy environments to participate in their education? Right now, that may be at home, but just wanted to hear your thoughts about this current.
Yeah. Well, as a general default position, Marlene, it is important to try as best as you possibly can to get the children back to school because of the downstream unintended ripple negative effects that occur when you take them out of school. Working parents have to completely adjust their schedule to take care of the children. Some children rely on school for a healthy breakfast or a healthy lunch. I mean, those are things that we need to take. The psychological negative aspects of keeping children out of school is substantial. Having said that, when you make a decision from a public health standpoint about opening the schools, what is paramount is the health and safety of the children and the health and safety of their teachers, which means that you may have to pause before you open up the schools, or you may need to make some modifications. Social distancing, desks further away, morning, afternoon classes, alternating days, hybrid of online, some classes, in-person others. I don't think there's a unidimensional formula for the entire country. Each individual location needs to make a decision based on the level of virus in your community at the time. There will be some counties that have so low level of infection that you could resume school without any modifications at all. There may be some cities or towns or counties where the level of infection is disturbingly high enough that you might want to make some modifications in your schedule, or even if the infection rate is high enough, you might even want to pause and do everything online.
And Dr. Fauci, once again, thank you. We just had a celebration of the anniversary for the Affordable Care Act, and we have still a patchwork of policies that make it possible for people to actually have access to care. Medicaid has been expanded in some states it's not, and we have a variety of premium options for people who are even on an Affordable Care Act supported policy or health insurance plan. So what are the conversations and what are the policies that we can look forward to that will guarantee that Black people really do have access to the vaccine when it is in fact available? And what are the conversations you're having with our national leaders now?
Yeah, Jesse, good question. I don't think I have a necessarily satisfactory answer to you, but I can tell you a bit about the conversations. The federal government is going to do advanced purchasing of the vaccine from the companies. The distribution of that right now is still under consideration. I would like to see, and I make this very clear in my discussions, that there is no instance where someone can't get a vaccine because they can't afford it, that it's available to everybody, whether they can afford it or not. That's what I would hope is the ultimate end game of all of this. Whether it happens or not, Jesse, I can't guarantee, but you know where I come from.
We need you there to keep.
Absolutely.
Can you talk about what new treatments and vaccines are being researched that you're most excited about? And kind of what the thoughts are around mass production of it and how you see it being made available? You spoke a little bit to this, but can you please elaborate?
Yeah, vaccines. There are a number of vaccine candidates that are being pursued. The federal government is involved in collaboratively helping the development of at least 5 or 6 of these. One we announced today is going into advanced phase 3 trial. Hopefully, if things go the way we like them to go, that vaccine might be available by the end of this year, the beginning of 2021. But it's not the only candidate. There are multiple other candidates. With regard to treatments, there have been 2 clinical trials that have shown 2 separate treatments are advantageous for advanced disease. One of them, dexamethasone, was done in a randomized placebo-controlled trial in hospitalized patients on ventilators and those who require oxygen, and it showed it has significant diminution in the death rate. But that's for people with advanced disease. In addition, another drug called remdesivir was a drug that was given to people requiring oxygen. And in that particular situation, it diminished the time to full recovery when they get discharged from the hospital. What we absolutely need are drugs that we're testing in clinical trial. We don't have the answer to whether they work or not. And those are drugs you can give early on to someone to prevent them from being hospitalized, as opposed to treating them once they are in the hospital. So there's a whole bunch of treatments and a whole bunch of vaccines that are being pursued. With regard to your question about availability, we're going to do everything we can to make sure when these vaccines are proven to be safe and effective, they are widely available to everyone.
Dr. Fauci, how many Blacks are in the current trials you just discussed?
Well, the trial started today.
So how many participants?
Well, I don't know. It's
all right. What's your goal?
I've been talking to you guys all day.
I'm not going to put you on the spot, but I hope you have a targeted goal.
No, we do. I mean, there's going to be 30,000 people in the trial. Okay. Already 18,000 have expressed interest in going and have enrolled in the trial. And we understand there's something like about 19-20% of those are African American.
Outstanding. As you know, Rania shared with you, the Black AIDS Institute has opened up 2 clinics doing HIV testing.
Great.
Providing direct services in partnership with St. John's. As we reopen these clinics around the country, and other people go talk about schools, as Marlene asked, I know you're not the biosecurity expert, but what are your thoughts around testing facilities and buildings for COVID as we go to define the new normal?
When you say what's my view?
What's your opinion? Yes, because this has been testing the facilities for COVID.
Oh, yeah. I mean, obviously, you would want to do that for sure. You don't want people to come in to get vaccinated.
Sure.
End up getting infected. Yeah,
right. But it's been the hot topic in Good Morning America and everyone. So I'm confident people want to know about their residential and commercial space. It is the newest discussion at the advent of COVID.
Absolutely. We're very attentive to that.
And Dr. Fauci, because HIV is a sexually transmitted disease, is there anything about sexual health or reproductive health that we should be concerned about, or practices that you would recommend for people who are seeking to be sexually active in this time?
Well, remember we used to say, and we still do, Jesse, that if you're going to have sex with someone, know there and use the proper precautions depending upon what that status is. I think when you're dealing with COVID, you've got to be careful in relationships to make sure that you're dealing with someone who is not infected. Now, you may not know that because, many people are infected and they're without symptoms. So you might want to find out if someone has been self-isolating, whether or not they get tested. I think that would be important.
Dr. Fauci, is there anything else, any kind of lasting recommendations you want to give to Black America as it relates to COVID-19 and protecting ourselves?
First of all, don't be discouraged because this will end. This is not going to be with us forever. We've all been kind of one way or another locked down for the last 5 months or so. It's getting wearing. Please hang in there. Take care of yourselves. Physical distancing, wear a mask, avoid crowds, stay away from bars. I like bars. I'd love to sit down at a bar and have a beer and a little snack, but stay away from bars. That's what happens. That's a really prime place where it spreads. And do personal hygiene. Do those 4 or 5 things for a while longer, and you will diminish greatly the likelihood that you're going to get infected.
Dr. Fauci, thank you so much for being here and taking time with us. Your commitment to HIV, your commitment to the Black community has been longstanding. The relationship that we've had with you has been longstanding. And so having someone like you leading the COVID response is a secure feeling in a very uncertain time. So thank you so much for your leadership and your time today.
Thank you. Good to be with you. Thanks a lot.
Thank you.
Hang in there, please.
Please.
Take care. Good to be with you. Thanks for having me.
Okay.
All right.
Thanks for the generosity of time.
Dr. Fauci, thank you so much for your time. Thank you to each of our hosts from the BAI board for joining us for this special of The Blacker the Plan. These conversations are informative and powerful in helping Black America understand how we can protect ourselves and loved ones. We will see you all on the next episode of The Blacker the Plan. Until then, remember, remain uniquely and unapologetically Black because it's our people, our problem, our solution. Be and stay well. This special of The Blacker the Plan is dedicated to our founder, Phil Wilson's mother, Mrs. Ina Wilson, who passed away the day we taped this special with Dr. Fauci. She was the mother of the Black AIDS Institute. This is in her loving memory.